First are drugs with doses. Second is techniques of local anesthesia. Actually, local anesthesia in the surgeon's mind is anesthesia at a particular point. That is not local. Local anesthesia only means there is a local but a limited area of anesthesia where the person does not lose consciousness. Okay, if there is consciousness which is lost, that is technically a type of general anesthesia. So surgeons think local means local injection. It is not so. Spinal anesthesia is also a type of local. It is correctly called as regional anesthesia, where big areas in the body but fixed areas are getting anesthetized. Okay, so don't necessarily think local means in one point where I want to remove a lipoma or a fibroadenoma. That's not technically correct. Local actually is a type of regional anesthesia where certain areas in the body are anesthetized without loss of consciousness. Okay, now first they are asking about drugs. So obviously you first talk about lignocaine, bupivacaine. You can classify the drugs. They are classified as amides and esters. Most of the drugs we use are amides. If you want to know what is an amide, any drug which has two I's, lignocaine, bupivacaine, prelocaine, ropivacaine, all of these are actually amides. We normally use amides. The other groups of drugs are esters, which have only single I in their name. They are not so commonly used in general surgery. So then you talk about the drugs dosages. So lignocaine available as 0.512%, right? And without adrenaline, it is 3 to 5 mg per kg. With it is 7 mg per kg. This is the most important one. We use it very often. So we know. Many times we use a mixture, lignocaine, bupivacaine, because bupivacaine is a little longer onset, longer duration of action. So its dose is 2 mg per kg. These two are the most important ones you should know. Bupivacaine is the one we use in spinal and epidural because it has a longer action, but it is having some cardiotoxicity, so it should never by mistake be given intravenously, right? Even lignocaine is an arrhythmogenic, but bupivacaine can be worse. Then you have the others, prelocaine, ropivacaine. Prelocaine is 6 mg per kg. Ropivacaine is 3 mg per kg. Ropivacaine is the one that we commonly use in nerve blocks. So these are the drugs with their dosage you should know. Then about the techniques. So again, see, I have made a very simple table. If you put a table like this, life becomes easy not just for you, also for the surgeon who's going to check your paper, because you know surgeons don't have much patience. They are not going to check each and every word, each and every line. But when they see something like this, no, they are very like, even if some big mistake blunder is there, na, they will let go.